Hello and welcome to the MediByte channel. I'm a healthcare professional here at MediByte, and today we're using this explainer topic to tackle a really important topic, an overview of menstrual cycle problems. We are going to completely demystify the complex, vital hormonal symphony that is the menstrual cycle. We'll break down exactly how it works, and more importantly, how you can understand and manage the problems that pop up when things don't go exactly as planned.
So let's dive right in. Ask yourself, what actually happens when this perfectly timed biological symphony plays out of tune? Look, whenever there's an unexpected bleeding issue or a totally missed cycle, it naturally causes a lot of anxiety. It's scary. But right off the bat, I want to reassure you. While it's completely normal to feel concerned, the vast majority of causes for abnormal bleeding are not serious. Today, we're going to put the power of knowledge back in your hands by walking through exactly what's happening inside your body.
Here's our roadmap for this explainer. 1. The normal cycle. 2. Common problems. 3. Root causes. 4. Diagnosis. And 5. Treatments.
Section 1. The normal cycle, a hormonal symphony.
Before we can even talk about what goes wrong, we have to establish the biological baseline. Believe it or not, the complex communication network that controls your cycle actually kicks off in your brain. It starts in a region called the hypothalamus, which releases a hormone called GnRH in these little pulses. This signals the pituitary gland, also up in the brain, to release two key players, luteinizing hormone, or LH, and follicle-stimulating hormone, or FSH. Finally, those hormones travel all the way down to stimulate your ovaries, telling them to produce the main female hormones, estrogen and progesterone. It's this incredibly precise chain of command that ultimately controls menstruation.
So, what does this actually look like on a calendar? Well, we divide the cycle into 3 distinct phases. It all begins with the follicular phase. Day 1 is marked by the start of your period. At this point, estrogen and progesterone are low, which is exactly what causes the thickened lining of your uterus to break down and shed. But as this phase continues, estrogen levels start rising again, building up a brand new lining. Then we hit the ovulatory phase, which is triggered by a massive surge in LH and FSH. Just 32 to 36 hours after that surge begins, boom, an egg is released. Finally, we enter the luteal phase. Estrogen stays high, and progesterone steps up to thicken that uterine lining even more, preparing for a possible pregnancy. If the egg isn't fertilized, those hormone levels crash, the lining sheds, and the whole cycle starts all over again.
Section 2. Common problems. The deviations.
What happens when this perfectly timed cycle goes a little sideways? Let's demystify some of the medical jargon you might hear in a doctor's office so you can put accurate names to your symptoms. If you're experiencing absolutely no periods, the clinical term is amenorrhea. If you suffer from really painful menstrual cramps, that's called dysmenorrhea. And if you're dealing with unusually long or super heavy periods, your doctor will call that menorrhagia. Knowing these terms is a game changer because it gives you the exact vocabulary you need to advocate for yourself.
Now, the big umbrella term you'll hear most often is abnormal uterine bleeding, or AUB. Basically, AUB is any bleeding from the uterus that just does not follow the normal pattern. It could be too frequent, totally erratic, lasting way too long, or excessively heavy. Why does understanding this matter? Because AUB is incredibly common, especially right at the beginning of a woman's reproductive years during adolescence, and then again toward the end, during perimenopause and up to menopause.
So, what's the biggest culprit behind AUB? During those reproductive years, it's overwhelmingly something called ovulatory dysfunction. This just means the ovaries either aren't releasing an egg at all or they're doing it on a really unpredictable schedule. Here's why that messes with your bleeding. When an egg isn't released, your estrogen levels stay high instead of naturally dropping. This unchecked estrogen continuously builds up and thickens the uterine lining. Without the balancing effect of progesterone, that overly thickened lining eventually gives out. It breaks down and sheds incompletely and totally irregularly. That is exactly what leads to those prolonged, unpredictable, and heavy bleeding episodes.
Section 3. Root causes, structural versus non-structural.
Doctors need a way to figure out precisely why you're experiencing AUB, so they split the causes into 2 main buckets. First, we have structural causes. Think of these as physical, anatomical issues right inside the uterus. This includes non-cancerous growths like polyps or fibroids, adenomyosis, which is where tissue grows directly into the uterine wall, or precancerous conditions where the lining gets abnormally thick. Then, in our second bucket, we have non-structural causes. These are more systemic, hormonal, or even environmental triggers. This covers the ovulatory dysfunction we just discussed, PCOS, thyroid disorders, or even extreme physical or emotional stress and poor nutrition.
Section 4. Diagnosis. Finding the answers. Okay, so how do healthcare professionals actually investigate these deviations to find your specific answer? Well, we always start with a detailed menstrual history and a physical exam. But notice that pregnancy test. It's typically the very first step, even for teenagers and women approaching menopause. Why? Because pregnancy is actually the most common cause of irregular bleeding overall. Next, we'll run blood tests to check your hormone levels and look for anemia from blood loss. From there, we use imaging. A pelvic ultrasound is absolutely fantastic for spotting those structural causes like fibroids. Finally, a doctor might take an endometrial biopsy just to check for abnormal or precancerous cells in the lining.
Section 5. Treatments. Medical resolutions.
We've reached the resolution phase. How do we safely manage and treat these issues once we have a diagnosis? Well, treatment heavily depends on your age, the severity of the bleeding, and whether or not you want to become pregnant. We usually start with medications. Non-hormonal options, like standard NSAIDs or a drug called tranexamic acid, are often the go-to if a patient is trying to conceive. However, if pregnancy isn't the goal right now, hormonal options like combination birth control pills or progestin therapy are incredibly effective. They essentially hit the brakes on the bleeding by balancing out those hormones and stabilizing your uterine lining. And of course, if chronic bleeding has depleted your body's reserves, we prescribe iron supplements to treat the anemia.
Now, if medications aren't quite cutting it, or if there's a specific structural issue, we look at procedures. A hysteroscopy with a DNC involves gently scraping the uterine lining to reduce the bleeding. For some patients, we might use endometrial ablation, which actually destroys the lining to control persistent bleeding. Though keep in mind, this option is absolutely not for anyone who wants to get pregnant in the future. If fibroids are the main troublemaker, we can block their blood supply through a procedure called embolization. Finally, a hysterectomy, the complete removal of the uterus, is a permanent solution. But I want to make this crystal clear. Doctors will always make every possible attempt to avoid a hysterectomy, especially if you desire future childbearing.
So, let me leave you with this question. Are you ready to take charge of your reproductive health? We've covered a ton of ground today, but the most important thing you should take away from this explainer is that menstrual cycle problems, while super frustrating, are highly understandable and highly treatable. You really do not have to just live with the anxiety or the discomfort. If you found this breakdown helpful, please drop a like on this explainer. Share it with anyone who might benefit from understanding their own biological symphony. And absolutely, make sure to subscribe to the MediByte channel for more accessible health education. Thanks so much for watching, and take care of your health.